Gastroenteritis with moderate dehydration. Definition: microorganisms cause gastroenteritis by secreting toxins that stimulate excessive water and electrolyte loss, thereby causing watery diarrhea, or by directly invading the walls of the gut, triggering inflammation that upsets the balance between the absorption of nutrients and the secretion of wastes. Definition of dehydration. Dehydration occurs when you use or lose more fluid than you take in, and your body doesn't have enough water and other fluids to carry out its normal functions. If you don't replace lost fluids, you will get dehydrated. Anyone may become dehydrated, but the condition is especially dangerous for young children and older adults. The most common cause of dehydration in young children is severe diarrhea and vomiting. Risk factors for gastroenteritis include age. Infants and young children are at an increased risk due to their immature immune systems. Anyone with a weakened immune system, living in crowded areas, and traveling, especially to areas where water and food may be contaminated. The risk for getting gastroenteritis is also higher in the winter. The doctor will likely diagnose viral gastroenteritis based on symptoms, a physical exam, and sometimes on the presence of similar cases in your community. A rapid stool test can detect rotavirus or norovirus, but there are no quick tests for other viruses that can cause gastroenteritis. Gastroenteritis attacks your intestines, causing signs and symptoms such as watery, usually non-bloody diarrhea, nausea, vomiting, or both, stomach cramps and pain, occasional muscle aches or headache, and a low-grade fever. Signs of dehydration include tiredness, dizziness, weakness, lightheadedness, dry mouth and or a dry cough, high heart rate but low blood pressure, loss of appetite but maybe craving sugar, constipation, dark-colored urine, and decreased wet diapers in babies. Nursing interventions for gastroenteritis include reducing infection transmission, preventing dehydration, maintaining adequate nutrition, and maintaining body temperature. When your child has an intestinal infection, the most important goal is to replace lost fluids. This includes helping your child rehydrate, getting your child back to a normal diet once hydrated, avoiding certain foods, making sure your child gets plenty of rest, and avoid giving your child store-bought antidiarrheal medications unless advised by your doctor. The best way to prevent the spread of intestinal infections is to follow these precautions. Get your child vaccinated. A vaccine against gastroenteritis caused by the rotavirus is available in some countries, including the United States. Given to children in the first year of life, the vaccine appears to be effective in preventing severe symptoms of this illness. Washing your hands thoroughly, use separate personal items around your home, prepare food safely, keeping your distance, and checking out your child care center. Make sure the center has separate rooms for changing diapers and preparing and serving food. The room with the diaper changing table should have a sink as well as a sanitary way to dispose of diapers.